Thanks for having me back again, and we had some great speakers this morning. This talk's going to be really different and hopefully really short, it's going to be more of just a digest what we've heard so far. I do want to do one thing though before. I want to make one announcement, just because I'm up here and I just thought of it, and I have no filter. The LGS Foundation has been growing, whether we like it or not. We actually have about 5,000 families in our online support group and in our community, and that's a lot. And this year, we were awarded, we had to apply the responsibility to host a meeting at the FDA, where they approve all of the drugs that our kids are on. And not just drugs, devices and biologics and other things. And so this November, on LGS Awareness Day, November 1st, we are hosting something called the Patient-Focused Drug Development Meeting. Ph.D. is what we're calling it. And the LGS Foundation is going to go up in front of the FDA and represent all of you guys and tell them whatever it is that you think they should know about LGS. And there's two questions that the FDA deals with. There's a lot of things FDA doesn't deal with, like they don't deal with drug pricing, right? They don't deal with insurance coverage, but what they do deal with is they want to know what's it like living with LGS every day, and they want to know if the therapies are working. And if they're not, what would an ideal therapy look like? And the reason I'm telling you this is two reasons. First of all, for those of you, we are putting together a little video of, what did your LGS day look like with a couple families? That's going to be 1 to 4 today. So I'll talk to you guys after the break that are doing that. We're going to be filming that. But for the rest of you, we're going to be putting out surveys. The foundation to be putting out surveys because we want to hear from you. We want it to be in your words what it is like living with this horrific condition, and also what it's been like interacting with the therapies. Do they work? Do they not work? How often do they work? Who do they work for? Who do they not work for? So that the FDA can take that back and make better medicines and better devices and better biologics. So this is really important. This is a huge deal. And so we hope you guys will join the surveys, participate in the meeting live. It's going to be streamed live on November 1st on LGS Awareness Day. We're going to make all the poor all FDA people wear green and purple. Yeah. And it's a really important chance for us to get our voices heard in the LGS world. And not just us, it's going to be all of the developmental epileptic encephalopathies that Ingrid talked about that are going to be sort of communicating the same message, which is we need to do better. Thank you. Well, thank you for your help. And we love that there are drugs, but we need to do a better job making them. So, okay, with that, I'm going to move on. And if you have any questions about that, please ask me. But we hope when you start seeing that stuff come across the Facebook page and stuff that you'll help us get the word out. So this is going to be a really practical talk about the causes of LGS and what do they mean. And I hope you guys will come up and ask questions after or ask questions during the Q&A if you don't understand. But we've heard a lot about things like this. I spoke about this, Ingrid spoke about, I think this has been about 6 of the talks we've had so far. The ILAE epilepsy classification, or the International League Against Epilepsy. But where do you fall on this as a patient? Like, this is just this chart. So where are you? Where's your kiddo, your loved one? So at the top, you've got seizure types. Does your kiddo have focal seizures? Do they used to be called partial focal seizures? Do they have generalized seizures? Do you not know? Because the only way to know what kind of seizure it is to see it on an EEG and then to look clinically at what's happening to the child while they're hooked up to that EEG. Or do you have both? A lot of our LGS kids have both. And so you should really know what kinds of seizures that your kid has and how to identify them. You have some agreed upon language with your doctor of what you count. Just give up counting everything right now, okay? Because we're not going to be able to count 1,000 seizures a month. It's just, but count the stuff that is important to you to track. So, and the most problematic seizures, maybe the ones with the falls or the ones that don't stop after 5 minutes. You need to know your seizure types. You also need to know your epilepsy types. So there are focal epilepsies where it's just, a part of the brain where the seizure starts, or the generalized epilepsy. So the seizures are coming from the whole brain, or they're coming from different places at one time. And there are combined where you have both of these. And then there's ones where we don't know. Maybe the MRI is normal. Maybe the EEG is normal in the beginning. Our first 8 EEGs were all normal. But it's really important for you to know the epilepsy type because seizure type and epilepsy type are how doctors decide therapy. That's it. I mean, it's like, so you want to get into the mind of a pediatric neurologist or an adult neurologist, that's it. They're going to look at your seizure types, they're going to look at your epilepsy type, and then they're going to have a list of things in their head that they might want to try you on. And then that's not all they're going to look at, but those are two really important classifications. And so when there's a drug that comes out on the market, it's for seizures associated with LGS. Well, what kind of seizures? Drop seizures, seizures that would make someone fall to the ground. So unfortunately, I love Zach's line that kids don't read textbooks. A lot of times, our kids will go on a medicine that's designed to help them, and one, they'll either just get overall worse, or it'll make one seizure type worse because they're having 6 or 7 different seizure types. And so it's important for us to know when that happens and to track that. But the conversations that you're having, it's like I always used to wonder, it's like, what's going on in the mind of the neurologist when he's saying, I think you should try the ketogenic diet? And it's like, because the ketogenic diet has some data to suggest it works with these types of seizures and this type of epilepsy. It's really that simple. So you really should know those. If you don't, we at the foundation want to help you to have that conversation with your doctor if you don't know where to start. And then there's the epilepsy syndrome. That's the third one, the green box. You guys are all here because you identify in some way with Lennox-Gastaut syndrome, LGS. And even if you're close, and I'm going to talk about this at the end of my talk, if you're close enough, maybe you don't have the slow spike and wave on EEG, you've never had it, or maybe you had it, but you're not sure anymore because the paperwork got lost because your kid's 30 and we used to write everything on paper back then, or if or they don't have it yet. You're still welcome here. Just, come. This is the club no one wants to be in. That's us. So come and be in our fun club where our kids are having a lot of seizures, but we just try to survive it and still enjoy life a little bit on the way. So it's important to know your syndrome. If you're LGS, you have the criteria. If you're kind of LGS, if you're LGS-like, and so you would fit into developmental epileptic encephalopathy or DEE. But you're welcome here, and again, I'll talk about that. It's also on the right, you've got the red little boxes. These are etiologies or causes. So what caused the seizures that you're having? And so I'm going to talk about those more in detail, but they've divided into 6 of them. They're structural. So there's something on the MRI showing the brain structure is not typical. There's genetic. So there is a gene that is driving the seizures. Now, you can have a structural epilepsy that is also genetic, just to confuse you some more. So scientists are so awesome. They have multiple names for the same thing. So I'm going to try to help you guys with that a little bit. And then they also will have it can be this, but it can be both or none. Yeah, so we love science for that. It can be infectious, so meningitis, encephalitis, and other brain infections. Metabolic disorders, so we talked about, vitamin B6 deficiency. There are some other really severe degenerative ones where the brain actually starts to sort of degenerate over time that are metabolic. Immune, including autoimmune, and then unknown. If you don't know, then that's okay too. So when we when we look at the scientific literature, there's some evidence, it's not great, and I'll mention this in just a second, that suggests that we know the cause, that if you pull together a population of LGS patients and you identify the cause, that about 90% of the time we can tell you what it is. Is it genetic? Is it metabolic? What is it? If you ask patients if they know, only 30% of them actually know. And so I hear it all the time. It's like, my baby, they were born, they were blue when they came out of the womb, and they were in the ICU for 2 weeks, but I have no idea why they have seizures. And I promise you, the doctor stopped looking for the answer after your baby was born blue and spent 2 weeks in the ICU. They are probably thinking that something happened in the baby. There was a lack of oxygen, but that conversation should be had. You should really have that, and we want to help you guys to have that conversation to know the cause, because there are medicines now coming out that will treat these causes, and and also across the stages, right? So I know that we've talked a lot about genetics, and if you have a genetic epilepsy, you have like lack of oxygen at birth or something, there's still a lot of exciting stuff that's coming out that we're able to help babies with, like the inflammation stuff that Dr. Ko talked about. Whole body cooling is one of my favorite stories with the babies that are born with this, that is helpful to reduce inflammation and things like that. So you want to know your cause too. So we all have LGS secondary to something. So I have LGS secondary to genetic, I don't personally, my daughter does, to genetic mutations. And she has a normal MRI for now. But you want to know all of these things. And so it's not either or. I meet a lot of families that are like, oh, well, we have SYNGAP1 mutation, but we don't have LGS. And it's like, well, did you have slow spike and wave and more than one seizure type? And did you have developmental delay or intellectual disability? Yes. I'm like, okay, well, you have LGS too. And you have both. You have LGS secondary to SYNGAP1 mutation, and you now have two communities that might be able to help you. And you get to pick. And, a lot of our kids have cerebral palsy. We should be in that community too. And a lot of kids have autism, and we should be over there getting resources in that community. So it's all of them. Have them all, and then find where you fit. Find where you fit. So when I go into the autistic communities, my kid's really mild. She has one repetitive behavior and is really social. And so when I'm in there, I'm like, yeah, this just isn't my biggest problem. It's the seizures for us. So we're going to go over it. And it's the intellectual disability, so we feel more at home here. So you have these choices. And then on the left, the big circle are the comorbidities. So these are all the other things, the speech delay, the sleep problems, the constipation. Oh my gosh, the constipation. The tube feeding, you name it, it's everything else. And the medicine, there's no such thing in LGS as a comorbidity that's not somehow related to seizures. I think that, the seizures get worse and these things all sort of fall apart. The feeding doesn't happen, the speech doesn't happen, the going to the bathroom doesn't happen, and so it's hard to separate them out. So when you go on a medicine for the seizures, it can affect all these other things, speech and sleep and sensory issues and perception and memory and all of these things. And so we don't have a lot of good ways to deal with those, but the thinking has been, well, let's just add more medicines. We'll give you a sleep medicine now, and I don't know about you, but at one point we were on 7 different constipation treatments for her constipation, and then we're gonna add on some stuff for the behaviors, and so they're on this cocktail, and there's really just not a lot of data about how all of these, we have information on how seizure drugs interact, but how do they interact with the sleep meds, and how do they interact with the behavior meds, and how do they interact with the constipation meds, and so, we're starting to think about these things as patients, but you as a patient just want to know these things. So that's where you fit. So let's talk about the causes a little bit more. So this is one way we talk about it, structural versus unknown. So 70% of LGS cases, there is an abnormal MRI. And that can be genetic, it could be acquired, right? So it can be, you can see birth injury in a lot of cases on the MRI. You can see things like, I'm going to list them here because, congenital malformations of development, focal cortical dysplasias, cancers, tumors, tubers, cysts, vascular malformations. If you've heard any of these words, and there's an abnormal MRI, and there's others I haven't even listed here, lesions, neurocutaneous disorders. They might be called a lot of different things by a physician, and they mean a lot, but really it just means the MRI is abnormal. It's really important to know. And then in about 30% of cases, the MRI is normal to begin with. It can change over time. So my daughter's MRI was normal until she was about 23, and then now she shows some cerebellar atrophy, which means the brain cells in the cerebellum are starting to die, and it's probably because she's been on a certain medicine for a really long time that's known to do that. So it can change, but you want to know these things, and you want to talk about them, and you want to understand how the medicines relate to that. Is there any evidence this medicine I'm going on is good for vascular malformations, or is it bad? So what we're really trying to do with this talk is to help you kind of know the things that the doctor is telling you or not telling you. A lot of us, I met another 2 moms yesterday, found out about that their kid had epilepsy or Lennox-Gastaut syndrome the same way we did, which is by requesting the medical record and reading it for the first time because no one told us about it. So we want you guys to feel empowered. And if you're not feeling empowered right now and you're just feeling overwhelmed by this talk, you can just totally ignore ignore it too. Wherever you're at, it's fine. It's fine. But this is how the doctors are thinking about it. So is the MRI normal or not? Now let's talk about the breakdown. So this is not the best, as a scientist, this is not the best scientific data, but there are a couple of papers out there that sort of break down what causes LGS and how often it happens. So structural brain injury is 33% of the LGS cases. So this is lack of oxygen at birth, birth trauma, umbilical cord around the neck, stroke at birth, something like that, where there was some sort of a traumatic brain injury, is another way said, at birth or early in life that caused it. And that's by far the biggest cause of LGS in our community. And so you want to know if you have that. Another word that's used to say this is it's an acquired epilepsy. You acquired the seizures after the injury. And the reason that's important is because tomorrow we have 2 sessions going on at the same time, one on genetic epilepsies by Dr. Mefford and one on acquired epilepsies by Dr. Randall. And so if you go, you'll have to decide which one you want to hear because they're happening at the same time. We're going to record them so you can watch them later, but you want to know where you fit. So about 17% are structural, where there's a congenital abnormality, meaning the brain was abnormal at birth. So this is like the brain didn't develop right, maybe a focal cortical dysplasia, or maybe parts of the brain maybe didn't form fully, agenesis of the corpus callosum, or maybe there are parts of the brain that are missing. But this happened sort of in utero is the thought, but it's still structurally seen on the MRI. It's about 17%, so that's the next most common cause. If you take a group of LGS patients and you just say, what caused that? 17%. Again, not the best data, but at least we're moving towards data on what's the breakdown. And it'll get better and better. Dr. Berg talked about her studies, and she's doing some of the best work on this, really looking at like what caused it and how often does it happen. So genetic de novo is about 15%, so this or even inherited. So this is where the gene is really driving the condition, and the MRI was normal at that time. Or there was a very specific malformation in the patients. So it's primarily the gene that's causing it. And that's about 15% of the time. And that's important to know because, we talk about genetics all the time, but it's actually it's the 3rd most common cause of LGS, right, in terms of what we're talking about. Infections are next. That's about 15%, with meningitis and encephalitis being the most common, but there are definitely other brain infections that can lead to this. And they happen in early life. Metabolic is 9%, 1%, actually less than 1% are immune. I have not yet met a patient who has had an autoimmune form of LGS, but I know they exist here. And then there's the unknown category. And I'm not sure, I've met a few families here who have had like chemotherapy and then developed seizures after that sort of environmental. I don't know if you guys are structural. I don't know where you guys fit into this pie chart, but I know there's a lot of causes aren't represented here. And then about 10% of us don't know. And so again, it's just, why do you care? What your cause is because again, the doctor is going to be deciding treatments, and we want to move away from this dartboard treatment idea where we're going to pick that one, which was our journey. And a lot of people's journeys. We want that to be better in the future. So knowing the cause can actually really help doctors and to advance the science. And in some ways, you guys are going to have to go back and educate your doctors that you want to know this and that this is important. And if you're not happy with your doctor, you can always go talk to another doctor. It doesn't mean you're leaving that doctor. You just go find another one to just chat with about your cause. But we really do want you guys to understand the cause of your seizures. And then I just want to end with this. So you guys saw this chart yesterday. This was the evolution over time. So the foundation is at a place, this is my last slide too, where if you have LGS or anything that looks like LGS, if you are in the really crappy seizures club, which is what we call it at the foundation, again, the club no one wants to be in, if you're in this, we are here to support you in your everyday life. That's what our foundation does. That will always be the most important thing, creating ambassadors to help you find resources. How do you get a wheelchair? How do you get a lift for your van? How do you find the right doctor? How do you get educated if you want to? How do you bury your head in the sand if you want everyone to leave you alone? Wherever you're at, we want to help you in your journey. And that's what we do here. So if you have LGS or anything that looks like it, this is your family, for better or for worse. We are your family. Yeah, I agree. The science side of things, we focus on the other half. And the two do meet together, but when we're talking about science, when we're talking about medicine and research, when I go out in the world and I talk to the physicians and the scientists, and a lot of those talks you've heard today, we're talking about the journey and prevention of LGS. And that's where the ideologies come in. So I have a 26-year-old that can actually really help explain epilepsy to the young ones that have the same genetic defect she has. And your kid, if they're older, can help explain and help it to be better for the next generation with the science. And so when you hear all the science here, it's up to you to decide if it's relevant, if you have time, like any of us have time for this. But I just want you to know that we have this whole community of support. But when we're out talking to the doctors, when we're out talking to the FDA, when we're out talking to pharmaceutical companies or device companies, we're saying, yes, there are patients that have LGS right now. We support them, and we never want you to forget about them. But what if we could have prevented the evolution to where those kids are now? And what can we learn about those patients today that will help us prevent it for the next generation? And so that's what we do at the foundation. I wanted to make sure you guys knew that because you've heard a lot of talks, and I'm not sure if I helped it to be more practical, where you could say, how does this even relate to me? Where do I fit into this? But that's how we're thinking about it at the foundation. And I will be around. Yesterday I was being followed around by like weird film group people. They're gone. So thank God. And thank you guys for being such good sports about that. But I'll be around. So if you have any questions about this, I think it's so important. If you want to know, and if you don't want to know, hey, hallelujah. Like my husband never wants to know anything. He's like, that's a doctor. I want the doctor to tell me everything's going to be fine. Take this pill and it's going to be great. That's what he wants in life. And I'm like, hey, rock on, man. I wish I could have that worldview. But I want to know everything. So wherever you're at is fine. But if you want to learn more, please come talk to me or talk to Christine or anybody. And I hope this was helpful. And now I'm going to bring up Jen, who we're going to have a way better talk from Tony, the dancing doc. And maybe put your boogie shoes on. Okay. All right. Thank you, everybody.